Hello friends, I am Dr. Deepak Agarwal. I am professor in neurosurgery at the All India Institute of Medical Sciences, and today being World Tuberculosis Day, I would like to highlight certain issues with tuberculosis which affect our specialty. Brain and spine tuberculosis is a devastating disease which affects a significant population of patients coming to my OPD. Now, what causes brain and spine tuberculosis, or what causes tuberculosis? Tuberculosis is spread by a microorganism known as Mycobacterium tuberculosis. However, all of us are exposed to people and other animals which have tuberculosis, but we don't get tuberculosis. So what actually causes tuberculosis is a host of factors which includes socioeconomic status. Like if you are poor and malnourished, you have higher chances of getting tuberculosis. Second thing is crowding. If you're in a crowded area with other people having tuberculosis, you are more likely to get tuberculosis, especially if you're not wearing mask, if you're exposed. And third, the most important is exposure to a previously open case of tuberculosis. Now, what is an open case of tuberculosis? Open case of tuberculosis is a patient having pulmonary or lung tuberculosis. So if you have pulmonary or lung tuberculosis, every time you breathe, you are pushing out this tuberculosis bacilli into the air. And other tuberculosis of the body like brain tuberculosis, spine tuberculosis, abdominal tuberculosis or other joint tuberculosis are not infectious because they are limited to that area. So those patients are not infectious. Only lung tuberculosis patients are infectious to other people around. What is the etiology, or how does tuberculosis reach the brain or the spine? From the lungs or from any part of the body which has already had tuberculosis, blood is the major carrier of this bacilli to other parts of the body. And this we call technically as hematogenous spread. So the bacilli, they go and they settle wherever they find a good place to settle, and it could be in the brain, it could be in the spine, depends on the immunity of the person. And that is why I'm repeatedly saying that the socioeconomic status, the immune status of the person is very, very important in deciding which part of the body will you get tuberculosis. What are the symptoms? Now this is very important. A lot of us may be harboring tuberculosis and we don't know about it, and we carry on till it reaches a point which makes us stop and see a doctor. If we had seen a doctor earlier, the treatment and cure would have been easier and earlier. Most common symptoms are somatic symptoms such as tiredness, lethargy. Patients also have unexplained weight loss. And when we say weight loss, it should be at least 10% of your weight over 3 months. And what are the common things you notice if you're having weight loss? Your belt becomes loose, your clothes become loose, and you have poor appetite also associated with it. Also seen in patients with tuberculosis is evening rise in temperature. What happens is during the evening you feel little feverish, and sometimes when you take a temperature at that time, it may show normal or little higher than normal. However, you feel feverish every evening. Very classical sign of tuberculosis. Another symptom which we see is night sweats. Now what are night sweats? Night sweats is you wake up in the night while sleeping totally drenched in sweat. So this also is one of the classical features of tuberculosis. Tuberculosis of anywhere in the body. So if you have any of these features, you should definitely see a doctor to get yourself investigated. Now what investigations to be done? The simplest is the blood test as well as the chest x-ray, which can show certain clues whether you harbor tuberculosis or not. Because tuberculosis is notoriously difficult to diagnose and treat. The two blood tests which we commonly do is ESR and ELISA. Although they are not very specific for tuberculosis, but they still give us a clue that you might be having TB. Other than these tests, if a doctor is suspecting brain and spine tuberculosis, then we usually get a contrast MRI of the brain and the spine, and these give a better diagnosis or confirm the fact that a patient might be having tuberculosis. Usually medicines are enough to treat tuberculosis. However, the important thing to understand is medicines or anti-tubercular treatment has to be given for a very long duration. For example, in chest or pulmonary TB, we give treatment only for 6 months. However, in brain and spine tuberculosis, treatment is given for a minimum of 1.5 years or 18 months. Many patients stop treatment in between when they start feeling better, and this is the worst thing one can do, because the bacilli or the tuberculous mycobacteria, they become resistant to the drugs, and now no drug will act on them, and they cause a entity known as multi-drug resistant tuberculosis, or MDRT, treatment for which is extremely difficult if impossible. So please remember, take treatment for the whole duration. Have your immunity high by eating high quality foods which are rich in protein. We usually advise for non-vegetarians that they should have at least 3 to 4 boiled eggs every day, and those who are vegetarian, we advise a lot of soybean like Nutri-Nuggets or other things in chapati, soybean atta, or anything like paneer which increases protein intake in an individual, because that is very important to increase your immunity, especially with tuberculosis. So final words, tuberculosis is treatable, is curable, provided you take good care of yourselves, of your health, of your diet, of your stress, follow doctor's advice and complete the treatment as advised. Stay safe, stay healthy. Thank you so much.